Hey guys, it's Leah Buckles. I am a physician assistant, U.S. Army veteran, and former CMP examiner. I wanted to come on today and discuss a condition that a lot of female veterans suffer from, and a lot of just women in general, and that is female sexual arousal disorder, okay? So this is a condition that a lot of women are service connected for or seek service connection for, either because they were diagnosed in service or because it may be related to another one of their service connected disabilities, right? So some of those common disabilities that we see it service connected to are things like PTSD, depression, anxiety, some of the medications that they may take for these disorders. So SSRIs or selective serotonin reuptake inhibitors like Zoloft or Paxil or Prozac, Celexa, some of these drugs that are known to at times cause decreased libido and sexual function, right? So this condition is under an umbrella of conditions called female sexual disorders, right? So there are things like, there are sexual desire disorders like hypoactive sexual desire disorder or female sexual arousal disorder, sexual aversion disorders, okay? There are some other types of female sexual disorders like orgasmic disorders, sexual arousal disorders, and just sexual pain disorders, right? But we're going to kind of talk about that sexual arousal disorder because that's the one that I see pretty frequently in female veterans, right? So these problems are, like I said, super prevalent, commonly associated with both physiologic, like physical conditions and mental health conditions, right? So typically, your healthcare provider may consider this when they've ruled out other things, maybe done some lab tests to make sure that there's, everything else is functioning properly, but you've had sustained sexual desire, decreased sexual desire for a period of time. It's impacting your mood, it's impacting your relationships, and just a variety of things, right? There are some clinical criteria that they'll go over to see if you meet that criteria, and that may be what you should be diagnosed with, right? As far as treatment goes, there are a lot of things that are targeted, whether it's counseling. There are specialists that deal with this on the mental health side from a counseling perspective. There are a lot of therapies that are used currently that may not be, that may be off-label use. So I know that there are some providers that give intranasal prolactin, and that may help some people. A lot of women also take testosterone, low-dose testosterone. The jury is kind of out on that. There are some medical experts, endocrinologists, healthcare providers that don't think it's appropriate. But then again, there are a lot that think that there is a significant uptick in sexual desire and function in ladies that take it. So, it's basically between you and your treating healthcare provider what you think is the best option for you, right? So again, when ladies get diagnosed with this condition, they may be entitled to service connection if they can show a link to their service or a nexus, right? A link to their service. This is going to be under special monthly compensation. I believe it's K, loss or use of a reproductive organ, right? So this is the same one that we see erectile dysfunction under for men, right? And so what does that mean? Well, typically it means you're probably going to get a 0% service connection for this. I mean, not always. I don't know. I'm not the ratings expert. Remember, I'm a PA. I'm not an accredited agent, right? This is just based on my experience on the medical side of things. A veteran can get special monthly compensation for this, and typically that's about $110 a month or so, on top of whatever you're service connected for. So if you're already 100% service connected, for example, you're going to get that extra $110 a month on top of that. It's extra scheduler, okay? So this is a condition that can be related to your service, and you can get service connection for it, but you have to have a diagnosis, right? So the CMP examiner technically can diagnose you with a condition as well. I don't know that they will, but it's definitely something that if you're suffering from, not only you might be compensated for it, but it's really important to try to get it fixed because a lot of women will say it's shameful, they're embarrassed about it and things like that. But do you want to go on the rest of your life living like that, or do you want to try to address the issue and move forward? So be brave, be strong, Don't be embarrassed. You're not alone, okay? A lot of ladies are suffering from this, and it can really change your life if you just go ahead and address it, right? So there are some other things, with to think about. So there could be pain disorder. So either chronic pain, which is kind of considered a mental health condition if you have chronic pain disorder or somatic symptom disorder, but also just chronic pain in general can decrease libido and desire. Vascular disorders, spinal cord injury, history of sexual trauma, multiple sclerosis, sexual abuse, all kinds of traumatic things can add to this, whether from a mental health perspective or a physical perspective. Like I said, if you've got some vascular or neurologic disorders. So it can affect a variety of populations, young and old, for physical, emotional, or psychological reasons, right? So I hope this was helpful for you guys. I hope it encourages you to get out there and, try to address it and know that you're not alone and that this is pretty common, right? So please drop some comments if you have any questions. And if you guys have any other topics you'd like to see me talk about, please let me know, because I'm always trying to think of new content to go over. All right. Talk to you guys soon. Bye.